Hello, I'm John Hemingway. Welcome back to Shropshire, and it's another nice day here, which is good. Hopefully a sign of things to come this year. And talking of the time of year, I thought today we'd talk about coccidiosis in lambs, and it's another topic that's not really groundbreaking. I think most people know something about cocci, and yet every year one or two people get stung badly by it, and it costs them productivity that they cannot get back. So I thought we'd use this video just to consolidate the practical points that you need to know to hopefully prevent yourself ending up in that situation. So coccidiosis, it's not a worm, it behaves a little bit like a worm, but it's actually a protozoal parasite. Other protozoa that you might have heard of include this one and definitely this one. There are two species of cocci which cause disease in lambs, but they're near enough identical, so we speak of them as being one. And these are different species to the ones that cause disease in calves. So there's no cross-contamination between these two. So this is a disease that most often occurs in lambs when they're sort of 6 to 10 weeks old. I've seen it in younger lambs, I've seen it in older lambs, but generally 6 to 10 weeks, 6 to 12 weeks, that is the high risk period. And that makes it an important differential diagnosis to nematodirus, which will often hit lambs at about the same time. And there's no reason that you can't have both of these diseases going on simultaneously. As with a lot of parasitic diseases, this probably often starts with an adult ewe or ewes that are asymptomatically carrying cocci. They've got it on board and they're shedding it, but it's not causing them any issues because they've got some natural resistance to it. Now, cocci forms little cysts, microscopic cysts called oocysts, and it's these that are shed out of the back end of carrier sheep, and they contaminate the environment. Now, this can happen indoors or it can happen outdoors, but generally the higher the stocking density, the higher the risk. What happens then is some lambs in that high risk age period will inadvertently swallow some cocci cysts, and that could be because it's on the bedding or because it's out on the grass or because it's in the water trough. Once the cocci is on board the lamb, in 2 to 3 weeks time, we will see symptoms. And the more lambs are exposed to that cocci, pick it up and start shedding those cysts, the greater the contamination in the environment and the bigger the problem becomes. So what are the symptoms? Well, we get scouring in some lambs, when we get very poor weight gain, we can get them looking very hunched and uncomfortable, straining, abdominally straining when there's nothing to come through, and sometimes this can lead to rectal prolapse. If you've got a lamb of this age that has rectal prolapse for no particular reason, you need to check that group for cocci because it's definitely a risk factor. Coccidiosis in lambs is what we call a high morbidity, low mortality disease. And what that means is, while yes, it can definitely kill lambs, a much more typical clinical picture would be to have a small proportion of your lambs that are scouring and look ill, but actually coccidiosis is in the whole group and it's drawing on the weight gain of all animals. And that is how this disease hits you in the bank account, subclinical production loss. So how do we diagnose this disease definitively? Well, we do it with a combination of the history and the clinical signs and a good old fecal egg count test. Now, it's really important to get a diagnosis on this, and that is because if you've got lambs that are 6 to 10 weeks old and they're scouring, it could be either coccidiosis or it could very easily be nematodirus. Now, if you think you've got cocci in your lambs and you treat for cocci and it was actually nematodirus, by the time you found out you made a mistake, you've probably got dead lambs. So we want to avoid that mistake. Grab some quick fecal samples, go to your vet or wherever you get your fecal egg counts done and check to see whether it is coccidiosis or nematodirus or both that are causing the problem. So once we've got a diagnosis, we want to treat this disease. There are only 2 products on the market that directly treat cocci in lambs. They are toltrazuril and diclazuril. Related drugs, but they're not directly interchangeable. Have a word with your vet about which one is the right one for you to use in your particular scenario. And so finally on to prevention, which is kind of the thing that we want to do in the first place. How can we prevent this parasite from getting on top of your lambs? Well, we can use grazing strategies similar to what we use for nematodirus. The cysts that come out the back end of infected lambs, they will overwinter on the ground and they will wait until the next year and can cause coccidiosis in next year's lambs. So if we had a patch of ground that we had lambs with cocci grazing this year, then next year's lambs, if we can graze them somewhere else to reduce the risk of them picking up the oocysts that those first lot of lambs left, then we will reduce our risk, just as we do with nematodirus. Let the nematodirus eggs hatch where they were left last year. Meanwhile, you're grazing your lambs somewhere else. We can use what are called coccidiostats, and these are good for people who are creep feeding or giving supplementation to their lambs. Coccidiostats do not kill cocci, they just stop it replicating in the gut, so they keep the level of cocci very low in your lambs. The product that we use for this is called dicoquinate, and you can get that added to your creep feed with a medicated feed prescription from your vet. Finally, we can do proactive treatment if we need to. If we have no choice but to graze a patch where we know that there was cocci last year and there's likely to be those cysts on the ground, well, once the lambs have been there for 2 to 3 weeks, we can treat them with one of the 2 products we spoke about just now, and that will kill the cocci that they've taken on board. So I hope that was useful. It's not that complicated of a disease, but we just have to be aware that it will survive year to year outside and in sheds if they're not cleaned out thoroughly. It's normally not a killer of lambs, but it will draw on your productivity, so it is worth knowing about. I'll be along with another video very soon, and I do hope to see you there. Bye.